Hi there, and welcome back to Anchor Point, the podcast from Freedom's Advocate. I'm your host, Randy Crossan. Today we're telling a story, one that should trouble anyone who believes our medical system exists to relieve suffering and not create it. Because when healthcare fails, utterly fails, what does desperation look like? And are we as a society okay with the results? In February 2023, Normand Meunier arrived at the St. Jerome Hospital north of Montreal with just a respiratory infection. He was a 66-year-old man, quadriplegic, living with limited mobility. He needed care and waited on a stretcher in an emergency room hallway for nearly 4 days. A proper mattress was requested. It never arrived. By the time he was moved, Normand had developed an aggressive bed sore. One nurse said it was the worst she'd seen in her entire career. The wound exposed both bone and muscle. He was in unrelenting pain. The infection worsened, and not long after, Normand opted for what is legally known as MAID, medical assistance in dying. We'll use the more direct term from here on, doctor-assisted suicide. A public coroner's inquiry is now underway. Normand Meunier didn't choose doctor-assisted suicide because of a terminal illness. He died after being denied basic medical care, a mattress, regular repositioning, and timely wound prevention. He died because of a lack of basic nursing care. Bed sores are painful and unnecessary. What does it say when a man is left in a hallway so long that it leads him to choose death? Is that choice really voluntary, or is it shaped by the absence of care? Would Normand still be alive if he had received the right support in his pain, and if his pain had been addressed properly, his dignity preserved, and his care managed with compassion? And if we called it assisted dying, does it distract from the fact that before assistance was ever offered, someone stopped offering to help him live? In Canada, there are policies and procedures meant to guide how doctors-assisted suicide is offered and approved. These include processes for screening vulnerability, requirements to ensure suffering is not caused by inadequate services, and expectations that other medical supports like palliative care are offered first. But are these processes being followed in practice? What happens when a person's suffering could have been relieved, yet wasn't? What if someone chooses death not because of their condition, but because the system abandoned them? How do we protect people from making a decision under duress when duress is the system's present approach? Across the country, palliative care remains uneven, access is inconsistent, and for many Canadians, especially those with disabilities, specialized care and daily support can be hard to come by. What happens when doctor-assisted suicide becomes easier to access than proper care? If someone asks to die but hasn't been offered meaningful support to live, is that a real choice? Do we risk sending a message, however unintended, that some lives are simply too expensive, too inconvenient, or too complicated to support? The coroner's inquiry into Normand Meunier's death is not just about one case. It's about a question we all must face. What kind of society do we become when death is an acceptable response to neglect? What does justice look like? Not just for Normand, but for every Canadian who depends on our system to care and not quit. Freedom's Advocate has helped several families who are concerned their loved one would be wrongly considered for assisted suicide. We're not here to tell you what to think, but we are here to ask what's worth thinking hard about. If death becomes the only option offered for those who are suffering, what does that say about us? And what will we do with the questions Normand's story leaves behind? As always, we're not here simply to talk about issues. We're here to do something about them. If you know anyone facing a medical system that is seemingly forcing a doctor-assisted suicide decision on them, send them to freedomsadvocate.ca. We will respond to them. You've been watching Anchor Point from Freedom's Advocate. If you want to learn more or support our work defending the rights and dignity of all Canadians, visit freedomsadvocate.ca. Thank you for joining me today. I'll see you next time.